I'm going to talk with you about terminal sedation. Terminal sedation is not physician-assisted suicide. It's not medical aid in dying. It's not death with dignity. So what is terminal sedation in hospice care? Terminal sedation is also known as palliative sedation, and it is a practice in end-of-life care where sedatives are used to relieve intractable suffering in terminally ill patients. Typically, it's by inducing a state of unconsciousness, but not with the intent to hasten death, just to provide comfort and a relief from suffering. The primary goal of terminal sedation is to alleviate such severe and unmanageable symptoms. These are often pain, just severe physical agitation, shortness of breath, or dyspnea, and as I mentioned in a previous video, even intractable hiccups. And of course, this would only be used when nothing else has provided comfort. It's crucial to understand that terminal sedation is not a form of euthanasia or physician-assisted death, medical aid in dying. The intent, again, is to improve comfort and reduce suffering, not to end a patient's life. Generally, this is how it works. Sedatives, often benzodiazepines, are administered to reduce or eliminate awareness, allowing the patient to rest and be free from unbearable symptoms. And it might not be obvious, but the patient may die from dehydration or other natural causes because they are now comatose. Terminal sedation is typically considered as a last resort when other palliative options have been exhausted and the patient's symptoms are refractory and causing intolerable suffering. The practice raises ethical questions and is subject to careful consideration by healthcare professionals, patients, and families. Generally, the primary hospice team is included in the discussion and in the presentation as an option to the patient and family. It is led by the medical provider and includes on the team the nurse, social worker, and chaplain. A careful review of the patient's trajectory is provided to the family and patient. They must understand that death may occur and the patient will no longer be able to communicate further. If the patient is able to be included in the decision, of course they are the ones to provide an affirmative choice. If they are already unable to participate in this level of decision, it's up to the family to make the decision. If the decision is made to go forward with this type of care, the family is guided into saying their final goodbyes. If a decision about final death has been made, it's really important that they all are aware. We are so fortunate, this is a rare experience, and that most symptoms can be managed without moving towards this final and extreme step. Let's just review. Terminal sedation is also referred to palliative sedation, continuous deep sedation, or sedation for intractable distress of a dying patient. When you're a member of the hospice team having faced this with a patient and family, it can open you to your own deep feelings about this one precious life we all have. Be gentle with yourself and let these experiences underline the importance of building practices for your own self-care. Thank you for your careful attention, and please don't hesitate to ask questions. Brenda and I are here at the Hospice Care Plan to do our best in supporting you with our experiences and getting you the best information so we can all transform the end-of-life experience into one of compassion and ultimately love. Thank you very much for listening. Don't forget to get our booklet, The Hospice Care Plan, at our Hospice Care Plan website, and watch more videos on YouTube at the Hospice Care Plan. Thank you.